Hey guys, today's topic is about malignant carcinoma of the breast. We have three types: the ductal carcinoma, the lobular carcinoma, and Paget's disease. First, we have the ductal carcinoma. Here we have the lobules arise from it, the ductules, and unite together to form the main milk duct. The ductal carcinoma arises from the epithelium of the main milk duct. The malignant cell starts proliferation. First, it becomes malignant carcinoma in situ. Then, after penetration of the basement membrane, it becomes invasive. The lobular carcinoma is the same, but the malignant cells is from the lobular epithelial cells. Paget disease, the malignant cells arise from the malignant cells of the main milk duct near the nipple, start moving and proliferation outside to the nipple on the skin and may invade the areola. First, ductal carcinoma, it is the commonest type. The main type of it is Scourge Carcinoma. It is an not otherwise specified carcinoma. High in fibrous tissue, it becomes hard mass. This is the most common type. It is invasive within 2 years if neglected. 2. The lobular carcinoma. Less common than ductal carcinoma. It represents 5 to 10% of the carcinoma of the breast. It is multicentric. It means that it develops in many sites of the breast, and bilateral in the both breasts. We have 3 grades. Grade 1, it is a low grade. Grade 2, moderate. And grade 3, it is highly malignant and aggressive. The Paget disease, as we said, it is a carcinoma in situ in the large duct. The malignant cells move to the nipple and forms nipple eczema. In the same time, the carcinoma in the main milk duct penetrates the basement membrane and becomes invasive. This happens within 2 years also. Early detection of Paget disease leads to good prognosis. We'll start with the types of the ductal carcinoma, which is the most common. First type, which is the most common also, is the Scourge carcinoma. In this type, we have high fibrous tissue and low cell ratio. It happens in over 50 years old postmenopausal women. It is the most common type, and it is not otherwise specified carcinoma. When cutting this type of carcinoma, we feel a gritty sensation like we are cutting in unripened fruit. And the color of the mass is grayish white, and because of the high fibrous tissue in this mass, after cutting it becomes contracture because of the fibrous tissue. It is invasive and fixed to the surrounding because of the high fibrous tissue ratio. The second type is Colloid Carcinoma. This type consists of large masses of spheroidal cells with minimal fibrous tissue separating it, and it is infiltrated by lymphocytes. Lymphocytes represents immunity. It happens to women in 20s to 40 years. We have high cell, low fibrous tissue, and the lymphocyte represents, as we said, the good immunity and good prognosis. When cutting this type of disease, it feels like we are cutting into brains. And we have hemorrhage and necrosis due to the high ratio of the cells. It is called Colloid Carcinoma because when cutting, it feels like brains because of the high cell ratio. No, the third type of malignant carcinoma, ductal carcinoma of the breast, is the Medullary Carcinoma. This type have a lot of malignant cells and infiltrated with higher count of lymphocytes. As we said, lymphocytes represent good immunity response. This type of malignancy looks very malignant and aggressive, but in fact, the high infiltration of lymphocytes make it a low-grade tumor. It has good prognosis. Fourth type is inflammatory carcinoma. As the name says, it looks like inflammation. We can also call it acute mastitic carcinoma or carcinoma of pregnancy and lactation because it comes in this period. It is characterized by severe inflammatory reaction due to high cell ratio. The cells die, release mediators. These mediators cause severe inflammation. The differential diagnosis for this type is lactational mastitis. The fifth type is papillary carcinoma. Papillary carcinoma consists of central vascular core covered by malignant epithelial cells. It starts in the duct. If neglected, it becomes invasive in 2 years, and the main characteristic of it is bleeding per nipple. The differential diagnosis for this type is benign duct papilloma. The sixth type is colloid carcinoma, characterized by high myosin in the cells, making the cells look like signet ring appearance. A tubular carcinoma, if neglected, also becomes invasive within 2 years. The carcinoma is characterized by appearance of vesicles on the breast filled with necrotic tissue and necrotic materials.